Did you know opportunistic vendors have been pitching self-funded health plans to direct their employees to take unregulated medicine from unlicensed foreign pharmacies? Unbelievable, but it's true. And that practice, known as global or international sourcing, is probably coming to an end. If you're the administrator of a self-funded health plan, a PBM, or a health benefits professional with exposure to one of these, you need to know about this important court case and your own potential liability. In 2024, Gilead Sciences sought a preliminary injunction to stop a chain of companies from dispensing illegally imported versions of its HIV medicine to U.S. patients. It started with an unnamed HIV patient who received foreign Biktarvy when he tried to get medicine using the health insurance he was paying hard-earned money for. The company's health benefits administrator, Meritain Pharmacy Services, told the patient to fill his prescription with Proact, a pharmacy benefits manager. When he did that, Proact declined the prescription and referred him to RxValet, an alternative funding program charged with finding prescription medicines at the lowest possible cost. The patient, though, was told to have their physician submit the prescription to RxValet's sister company, Advanced Pharmacy. But the medicine he received after he did that came from a retail pharmacy in Istanbul, Turkey, with labels from Affordable Rx, a U.S. company, that's just an intermediary for foreign pharmacies and patients. Although the Biktarvy at issue is in this case not fake, just foreign and unlicensed, illegally imported drugs are vulnerable to counterfeiting, and patients who take them won't get safety recalls. Additionally, labels in foreign languages can cause dangerous patient errors. The court in this case handed down a preliminary injunction, and it's an earthquake for self-funded plans. First, is your health benefits vendor telling you that having your employees import medicine is allowed because of some fictional personal importation exception? Well, boom, the court here says no, this importation is not legal. Second, this is a Lanham Act case, the law that governs counterfeits and trademarks. Financial penalties, even for causing the illegal importation of a single bottle, come with so many different types of damages you can't even count them. Finally, this injunction signals that importing this medication or being any part of this supply chain that caused it to be imported could result in financial and legal liability. If you're in the business of causing these importations, you may be on the hook for direct liability. But the court also called out the third-party administrator, Meritain, and Proact, the PBM, saying they could also have vicarious liability and be on the hook for contributory infringement. The court even went one step farther, identifying the conditions under which officers and directors of these companies could become personally liable and allow the trademark holder to what's called pierce the corporate veil to go after the assets personally of the leaders of the company. If you're a patient who's been advised to take these medications, show your administrator this video and reach out to us at editors@safemedicines.org to confidentially tell us your story. If you're a self-funded health plan, it's time for you to end this practice for your own financial and legal well-being as well as the safety of your patients. If you would like to tell us how you feel you were misled by your health benefits vendors, reach out to us at editors@safemedicines.org. And if you work in the health benefits space and have been talking to clients about international and global sourcing, you probably want to stop. You could have legal liability, and no amount of contract indemnification is going to protect you when your global sourcing vendor declares bankruptcy and their insurance coverage is exhausted. Learn more about the dangers of international and global sourcing at this page on our website, safemedicines.org.